To the Hobbit Premier.
Question number 7, Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What expectations has he set for district health boards and subsidiary entities for 2013-2014?
Honourable Tony Ryle.
Mr Speaker, I'd like to welcome the member back into her responsibilities. The expectations are summed up in the letter of expectations to DHBs and subsidiary entities for the 13-14 year are available on the Ministry of Health website. They've been there since the 6th of February. The headings in the letter are better public services, national health targets, care closer to home, the health of older people, regional and national collaboration, and living within our means. I can also advise that the government will be investing more money in health this budget, and this contrasts with the ongoing reductions in health spending in many parts of the world.
Supplementary question.
Well, in light of that answer, is the new way to provide his better, sooner, more convenient health service for charities to pay for the bandages and dressings for children with skin infections in Northland and South Auckland, because the government funding is not enough, and for charities to pay for medicines where family can't afford his new $5 prescription charges?
Honourable Tony Ryle.
Mr Speaker, the government's making a very large investment in the rheumatic fever program around the country, and we welcome any organisation who wants to join with us in backing that. The member will remember that rheumatic fever was made a national health priority in 2001, and that government did absolutely nothing in the subsequent 7 years. A priority in 2001, and absolutely nothing was done until this government put $24 million in.
Supplementary question, Honourable Annette King.
Thank you, Mr Speaker. They might want to listen to this question.
Supplementary question, Honourable Annette King.
Well, in light of that answer, why doesn't the Minister and the Prime Minister tell the whole truth about his flagship rheumatic fever program? That charities are helping to fund it in South Auckland because the DHB hasn't got enough money to be able to cover the 61 schools at higher risk of rheumatic fever. And can he tell the House, has all the funding actually been allocated for the program that he promised?
Man up, Tony.
Honourable Tony Ryle.
Mr Speaker, I'm advised that the Ministry and the Counties Manukau DHB intend to spend $11 million in the next 2 years on rheumatic fever, and they appreciate the $95,000 that the Middlemore Foundation is contributing to the program. This is an important program because rates of rheumatic fever were excessive and grew dramatically between 1999 and 2008, a shameful record of third world disease neglected by the failed party opposite.
Order. Supplementary question, Honourable Annette King.
Thank you, Mr Speaker. It's time he manned up and took some responsibility.
Supplementary question. Supplementary question.
Supplementary question, Mr Speaker.
Order. Order. The noise level now is getting quite excessive from both sides of the House. Would the member please ask her supplementary question?
Thank you, Mr Speaker. Why doesn't...
Paula Bennett.
Oh, come on, there's the old fishwife over there.
Order. Does the member want to ask us? Honourable Paula Bennett, unless you can stop interjecting across the House, I am going to ask you to leave the chamber. Honourable Annette King.
Thank you, Mr Speaker. Why doesn't he change his expectations of better, sooner, more convenient health care to worse, later and very inconvenient in light of the latest Quality of Life survey released yesterday, showing 46% of those who wanted to go to a doctor last year didn't because it was too expensive, because GP fees in some areas have doubled under his watch, and because poor children have to rely on charity to bail out their health services.
Honourable Tony Ryle.
No, because we'd have to adopt Labour Party policies if we wanted to do that. This government's determined to improve services for New Zealand, And the reason why we want to do that is because we are not prepared to accept, for the 6 years that that member was Minister of Health, the number of operations performed for patients went down. The budget went up and the number of operations went down. And we're not prepared to accept that. We're trying to provide better services for New Zealanders in much tighter funding circumstances.
Question number 8, Aaron Gilmore.
Thank you, Mr. Speaker. My question